some cancers are very treatable with just a little excision and plus or minus chemotherapy or radiation after surgery. And that's your breast conservation surgery or breast saving surgery. If it's feasible and it can be done, it's very reasonable to do that, because the ability to heal from that is much quicker. It's not as disruptive in their entire life as getting a full mastectomy and reconstructing subsequent to that. The opposite part of that, though, is if there's any strong family history, or there are gene positive where there are concerns about whether this can actually progress later or be present in the other breast, then in that case, I would probably lean more towards them considering a mastectomy. The first step is for a patient to understand, okay, there are many options that I have. What are my limitations in terms of being able to recover from this, in terms of whether you have a job or you're taking care of family members or children, or what is it that is your limitation first? Because that plays a big part of how well you'll be able to recover and how much time you have. The more stress you have about worrying about your recovery afterwards, the harder it is to recover. And so you want to kind of consider that as a part of your decision-making process. The second part is what are you willing to do in terms of reconstruction? I have some patients who will say, I don't want foreign materials in my body. I'll use whatever I want for my own body to help reconstruct the breast, but I don't want anything foreign. So are you okay with having implants or things that are used that are foreign materials, because they all have their own set of risks? If you have an implant reconstruction, there's a risk of it actually either rupturing or causing some sort of distortion, which may require a secondary surgery in the future. Typically, you replace implants every 10 years or so. So if you have that option, you have to think about, okay, down the road, I may require 1 or 2 different surgeries in addition to what I'm having now. And then am I okay with that? Whereas if you do tissue, you don't need that, but then tissue has its limitations on size. How much tissue can you use to help reconstruct the breast? And the recovery that you're going to have from taking it from one spot and putting it somewhere else. That would be the second part. The third part is recovery. What kind of help could you have helping you in the recovery process so that you can recover easier?